we're talking a lot about NCDs, and clearly everyone is. Can you talk to me a little bit about the U.S. position on NCDs here this week?
Sure. We've been part for a couple of years on raising the awareness and engagement of WHO in non-communicable diseases. And it actually, while it's thought of in the United States to have something to do with wealthier nations, actually it's a huge emerging problem in developing countries also. The high rates of diabetes, high rates of heart disease, smoking issues, preventable deaths are actually something that developing countries have a great deal of interest in. So this meeting will actually be coming up with some initial recommendations around where WHO wants to focus their time and attention. We had a first conversation about this in Moscow about a year and a half ago. A working group has been underway, and at this meeting I think the initial recommendation about 2 or 3 areas. We know there's a lot of agreement about going after tobacco use and smoking reduction. It's kind of a great bang for your healthcare buck, probably the best public health initiative. We think there's a lot of agreement around diet, particularly as regards sodium and lowering sodium content, dealing with a lot of the underlying degrees, and probably around exercise and nutrition also. So there's likely to be a lot of consensus that those are places that we all can start our efforts, but then continue on from there. The challenge with developing countries is they now have to deal with NCDs and infectious diseases at the same time. So help and technical support is also going to be part of this initiative.